Hi, welcome to Healthcare for All podcast. On today's episode of Universal Healthcare, what it is and why it matters, we're going to be talking a little bit about the pros and cons of universal healthcare. My name is Abby Bullington from Knoxville, Tennessee, and I'm majoring in marketing and management.
I'm Anna Crispino. I'm a business management major, and I'm from Colorado Springs.
My name is Jace McGoldrick. I'm a finance major from Philadelphia, Pennsylvania.
My name's Rechtin. I'm a statistics major, and I'm from Cincinnati.
My name's Hellman, and I'm a double major in finance and accounting, and I'm from Findlay, Ohio.
And today, Will's going to start us off, and he's just going to give us a brief introduction of what universal healthcare is.
So, what is universal healthcare? Well, universal healthcare is a healthcare for all system that would pay for anyone's healthcare regardless of pay or social status. The debate on whether to implement universal healthcare in the U.S. is a big one in U.S. culture today. Universal healthcare could be implemented in multiple different ways. So we want to discuss the pros and cons of universal healthcare and ultimately determine what would be the most efficient way to implement it.
This issue is very relevant in today's world because of rising healthcare costs. Healthcare expenses are increasing globally and often higher than the wage growth. In countries without universal coverage, millions of people face bankruptcy or even avoid treatment just because of these high costs that they're facing. The universal system aims to control these costs and reduce financial hardships for all and kind of just even out that wage gap. This is also very important because it will increase health inequality. So access to healthcare often depends on income, employment, geography, financial status. So this will just kind of like implementing a universal healthcare system can even out this gap. And it just really aims to close the gap between the rich and the poor by offering equal access to all.
Those are many of the reasons why people are arguing for universal health care in our country. However, opponents argue that it would require massive tax increases, it could lead to longer wait times and lower quality of care, it could increase government control and stifle innovation and limit patient choice. It also raises concern for the insurance industry and workers whose jobs depend on the current system. And additionally, one of the biggest arguments is the political divide, where generally Democrats are more supportive and Republicans tend to oppose this idea of universal health care.
And the Republicans normally being against universal health care, there are a lot of reasons why. High initial costs. It could create complex healthcare systems if we use the wrong type of universal health care. And then it could obviously create a lot of public outrage if universal health care is implemented. Not a lot of people may not like it.
One of the big arguments for why America should implement a universal healthcare system is that many other high-income earning countries, specifically in Europe, have really beneficial universal healthcare systems in place. However, they all look fairly different from each other. For example, in Germany, they have a multi-payer system with regulated competition. So basically, they have a universal healthcare system where citizens are required to have health insurance provided by nonprofit sickness funds, and the system is financed through joint employer-employee contributions, and it offers a blend of public and private healthcare services. Whereas in the Netherlands, they have a mandatory insurance with risk equalization. Their healthcare system requires all residents to purchase health insurance from private insurers, which are required to accept all applicants, and a risk equalization fund compensates insurers for high-risk individuals, which promotes fairness and prevents from discrimination. And then in the United Kingdom, they have a single-payer national health service. This provides healthcare funded through taxation, offering services free at the point of use. The system is publicly funded and operated, and it allows for private healthcare options. And the NHS model emphasizes equity and comprehensive coverage. The things that make these systems different is the single-payer system is where a single public agency handles healthcare financing, and it collects all healthcare funds and pays all healthcare bills. It's primarily funded by taxes, and everyone is automatically enrolled and covered. There's no separate premiums, deductibles, or copays in many cases, and the government acts as the sole insurer. Private insurers, like in the Netherlands, are companies who used to provide coverage, but the government strictly regulates them to ensure fairness, affordability, and universal access. Citizens are required by law to purchase health insurance under these systems, and insurers must accept everyone regardless of age or pre-existing conditions. Premiums can be subsidized by the government for low-income individuals, but there's often a basic package that all insurers must offer. Whereas in Germany, the nonprofit sickness funds are nonprofit insurance organizations. They're funded by payroll taxes shared between employers and employees and are legally required to operate nonprofit. This requires citizens to choose from a variety of different funds, all offering the same standard package, and these funds are not allowed to make a profit off basic healthcare services. The government regulates these prices and services uniformly, and higher income individuals can opt for private supplementary insurance if they choose to.
Building off Anna's last ideas, the single-payer system seen in the UK and Canada is definitely appealing to the US because it has potential to cut costs such as billing and insurance, and it also makes it easier to negotiate drug prices and medical costs. Moving on to the private insurers, seen in the Netherlands or Switzerland, the appeals to the U.S. is it keeps consumer choices and competition, which some Americans value, and it also builds on the existing U.S. model with the universal rules and access. And with a nonprofit sickness fund, it's appealing to the U.S. because it retains multiple insurance options, but removes profit incentives from essential healthcare. Also encourages social solidarity. All working citizens contribute and receive care.
So I've actually been kind of affected by this personally. So about 2 weeks ago, I had to go to the doctor, ended up with strep throat, and they notified me at my doctor's appointment that as of May 1st, that the University of Kentucky will no longer be accepting my insurance, which is Cigna. And this was kind of like a new problem that I had to do some research on myself. But with a universal healthcare system, this would be a lot less of a problem because I wouldn't be required to pay these high out-of-pocket costs that just come with a routine doctor's visit. I had to go to the hospital back in late December, and with my insurance coverage, it only ended up being around $300, but the bill before my insurance covered it was around $3,000. So with the university no longer accepting my insurance, it's going to be a lot harder for me to find care that isn't going to be crazy expensive.
Yeah, and I think a lot of people can kind of relate to that problem, but on the other hand, if universal healthcare and all the insurance, you don't really need an insurance anymore, what's going to happen to the insurance companies after that?
I think in my situation personally, a single payer model would be very beneficial because, like Anna said earlier, it is paid by the government through taxes, and the care is it can be provided by public or private companies, and there's no profit motive to it. And it would require the least amount of fundamental change because it is the most similar to the healthcare system that we have currently.
Building off of that, insurance companies have seemed to be one of the biggest pushbacks that has stopped universal health care being implemented in the United States. With stuff such as copays, deductibles, and premiums, they negotiate their prices with providers and hospitals.
So without these insurance companies getting their profit from people paying for different types of insurance, it would basically put them out of business depending on what model of universal health care we switch to.
Yeah, so on top of the insurance companies, there are also medical professionals that are against it and some that are for it. The ones that tend to go for it are ones that have their own healthcare practices and people come and visit them, so they make the most money off of this, what our current system is right now, versus younger healthcare professionals tend to work in doctor offices, hospitals, stuff like that, so they get paid by the hospital directly. So the more money the hospital makes is the more they make.
We actually had some questions that were left on our blog from last week's episode. So, Jeremy from Canada actually shared a little bit about his personal story. So, he moved from Canada to the United States, and as we know, Canada has a universal healthcare system, and the United States does not. So, he wants to know his question was, do you think healthcare should be a basic human right or a service like any other?
I can answer that somehow. I think as much as it should be a human right, it is also a service in the way that it is a high demanding job and a business. Hospitals need the best technology, the best tools, best doctors, and they need to pay for that. So the money's got to come from somewhere.
I actually believe healthcare should just be a human right. The government makes money so that it can take care of its U.S. citizens. They want to keep our citizens alive. So I think one of the best ways to do that is to make sure everyone has equal health care, and that's why it should be a human right.
Yeah, I also agree with that. I think that it should be a basic service that everyone has access to, not just because someone is like wealthy and can afford it. I think that even people who are poor should have access to the same basic rights and care that any other person should have.
Yeah, so back off of what Will said, it's the government's duty to protect citizens, keep them healthy, but we spend the most money on health insurance, stuff like that, but we rank 30th in countries in life expectancy and everything like that.
And to be honest, I think that's really why we need change, why we need to go to universal health care, because clearly what we're doing right now isn't working.
So we actually have another question. Amanda from North Carolina wants to know if we would be willing to pay higher taxes if it meant everyone had access to health care.
Well, this is actually a thing a lot of people don't know about universal health care. A lot of people would think that it would just make taxes higher all the time. And it will make taxes higher in the short term, but ultimately, over a certain amount of years, it will actually lower taxes than they are right now.
And it's important to note, too, that with a single-payer system, it would be healthcare being provided through taxes, but this would be such a good option for our country because it is such a easy transition from the system we have now. It looks most similar to what we already have existing.
An anonymous listener also had another question, and that was, could a universal system stifle medical innovation or competition?
So, according to FreeOp, the U.S. excels in science and technology sector, ranking first globally, but it lags behind in fiscal sustainability, ranking 32nd, meaning its healthcare spending is unsustainable.
Yeah, and a lot of critics argue that the universal healthcare system could reduce innovation because this would produce lower profits for pharmaceutical and medical tech companies, meaning they would have less money to invest in new technologies and procedures, and that these government-regulated systems may be slower to adopt funding. So basically, the funding that these companies would need for new innovation would just be coming from government tax dollars, which may not be enough to keep these like growing medical innovations.
Just to sum up everything that we've already said, universal health care is a healthcare for all system that would help pay for anyone's health care, regardless of their pay or social status. Today we've overviewed the political side of universal health care, and
Earlier in the podcast, I kind of talked about how implementing a universal healthcare system would be beneficial to many, and it would bridge the wage gap between the rich and the poor, allowing everyone to have access to adequate care.
I talked about the different models that a lot of European high-income earning countries use and how those could be beneficial to our country.
I was able to kind of build off the benefits that it would have for the U.S. as well as the insurance providers and what they do.
I was kind of on top of the insurance providers with the healthcare professionals talking about business versus employees versus employers, where employers don't want the universal healthcare, employees do, as it will make prescribing medications easier, stuff like that.
Thank you guys again so much for listening today. We hope you tune in next week for our episode called Staying Healthy as a College Student. We're going to be going over some important diet information, exercise tips, just talking about sleep and mental health. We're also going to have a special guest from a dietitian. And we just really hope that today's episode broadened your perspective about universal healthcare and the pros and cons that would come with implementing a system in the United States. Thanks.